Welcome back to Healthy, Happy, Wise, Wealthy. I have with us today Dr. Fawad Mian, and thank you so much, Dr. Mian, for being here with us today. Dr. Mian is at the intersection of so many things that are so critical for us with uh, figuring out, from what I've looked with you, is figuring out before we get sick, what can we do to stay healthy and well. And I want to mention our podcast sponsor, who is Mindy, Mindii, and they are an IT company out of India. They have 50 guys, women, men working with them on IT professionals, and they do everything. One of the things I've learned, Dr. Mian, is the term full stack, which I didn't know what that meant for IT, so I had to look it up. But they do. So if you're making like an app or a website for your company, they do the a really nice front
Mhm.
end. They do the back end, so you can, uh, so that works well, and then maybe connect it with Amazon or other things like that. So the full spectrum. So booking appointments, selling stuff on Amazon, all that kind of stuff. I'm sweating. I don't even
Wow.
know. It's morning here. It's a 6 a.m. morning. I just said to said to him. So you're on the East Coast though, and so
Mhm.
can you just start out? And I know you have a personal story of why you're a neurologist. Yes.
Right.
Um,
Yes.
yeah. So what took you into the realm of some of the regenerative medicine and patient education and the healthcare initiatives? Some of those things that you're doing.
Mhm. Yeah. Well, first, thanks for having me on the show. Deep appreciated, and early start for you. Um, but I've been a neurologist since 2009, and initially when I started out, within a short period of time, I developed some injuries. And one of the first things that actually happened was I was lifting some weights in the gym. The weight slipped a little bit out of my hand, and it injured a small little joint in my shoulder called the AC joint. And I went to the orthopedic doctor because that's normally what you would do when your shoulder hurts. And the
Yeah.
orthopedic doctor, one of the first things he told me was, you know what, maybe we can get a surgery out of you. Maybe you have something called a slap tear. Um, that's just, in English, that basically means some cartilage tear like in your shoulder. And so that's what that was. Unfortunately, I had an MRI which did not show that because I didn't want surgery. I've had
Hmm.
surgeries in the past too as well for various other things. But there was a lot of arthritis in there. And so, I had the doctor just well, actually not the doctor, the PA actually injected steroids into my shoulder joint twice. Still didn't feel that great. I couldn't sleep on my shoulder. I couldn't lift my arm above my head, or putting on a jacket would be a little bit tough. Putting on a shirt, and it was pretty miserable at the time. At the same time, I would also have patients come into the neurology office, coming from pain doctors and other orthopedic doctors, and they told me, these issues are coming in are neurological. They're not orthopedic, nor are they really pain related. Go see the
Yeah.
neurologist, and I would always scratch my head like this doesn't seem to make sense because it seems like they have these chronic musculoskeletal issues that are going on that may not be addressed. And so while all this was happening, one day I had gotten some new shoes, and probably like the second day I was wearing them, started walking, my foot just started hurting all of a sudden. And just give you context, I did training in New York City for several years, so I was always walking everywhere in dress shoes all the time. And so I
Okay.
was using these shoes, and I'm in New Jersey now, and I'm walking around, and now my foot is starting to hurt. Like, that's odd. Those shoes must be really bad. So I switched out my shoes, but the pain didn't go away. And it kind of lingered. And I did what everybody else would do. I, put my feet up, iced it, stayed off of it, did all of that. When all that was not helping, I went to the foot doctor. 'Cause again, that's what you do. You go to the foot doctor. And the foot doctor took some x-rays, gave me some expensive orthotics, which I thought would help. So I, and got them, which actually didn't help much things at all. It actually made things worse. But he said I had something called plantar fasciitis, which is just a way of saying that the tissue underneath the foot is actually irritated. And so I had gotten some steroid injections, just like I did with my shoulder. And, I'd gone through one round, didn't work, went through a second round, marginally worked. And then finally I got the third round, and I was like, you know what? I think I'm 50% better now, at least. So I was like, all right, it just was the third time was the charm really didn't have an effect. And so I went to the gym to run because I wanted to exercise again, and that was actually a mistake because I ended up irritating my Achilles tendon, which
Mm,
is the tissue on the back of the heel. I'm still
jeez.
not 40 yet at this point, and all this stuff is kind of breaking down.
Oh,
And I
no.
went back to the foot doctor. He did various other treatments, and things still weren't working out. As this was happening, it started changing the way that I walked because once things start breaking down, we're all kind of interconnected together. And so it changed the way that I walk. And so now my left knee was hurting. Just to give you background of my left knee, I tore my ACL around 2001 and had it surgically repaired. Or so I thought it was. And I was walking around, my knee was hurting. And I went to I basically had one of my colleagues write me up an MRI script after he looked at it. And I had an MRI of my knee. It showed just a little bit of fluid, but it showed that the ACL that was theoretically surgically repaired wasn't really repaired. And so it was just my knee was irritated. So between my shoulder, my foot, my Achilles, my knee, you can see like the downward spiral of everything that's kind of happening here, which is small little injuries that kind of keep piling up. And
Goodness.
so I would see similar things kind of also with my patients too as well. And in terms of the knee, I went to another orthopedic doctor and kind of just tugged on my knee a little bit without really looking at me, and said that he needed to scope my knee, see what he could look and see what he could do with that. And I was like, I don't really want to do that. It doesn't make any sense. I don't know why you would want to really do that for the injury that I have. Um, and so, between the shoulder doctor, the foot doctor, and this orthopedic doctor, they all kind of recommended surgery. The shoulder doctor recommended, you know what, you have some arthritis there. Maybe we just need to chop off part of the bone. Like, I don't really want to chop off part of the bone. I want to keep with what I came into this world with.
Yeah.
So I wanted to keep that. And then, the foot doctor was like, you know what, your Achilles is bothering you really bad. Maybe we need to shave down the bone. What really needs to be said is that you got to detach the tendon, shave the bone down, reattach it back onto the heel. You're in a boot and you're kind of limping around or in crutches for like a good period of time. So it's not like just a small thing that's done there. It's a protracted recovery for something like that. And in terms of the knee, I don't have an ACL or anything like that still, but I kind of looked for alternative treatments. And, I stumbled on something called Prolotherapy a long time ago. And so I went
Okay.
to get some training out west. I'm closer to your neck of the woods over there.
Yeah.
And, I had some injections done on, myself at the time. I was learning at training. Um, and then as time went along, I learned about PRP within shortly right after that, 2012, 2013. And, I started implementing that as far back as then with my patients too as well, because I was tired of seeing all these chronic pain patients where they were told things were neurological when I really thought they kind of honestly, they really weren't. They were just, um, they were downstream effects from the injury essentially. And so I
Mm,
implemented that in terms of my foot and my Achilles. I had PRP into that for my Achilles several times because it was that bad. The plantar fascia got better. In terms of my shoulder, thankfully, I didn't opt for chopping out anything. I did PRP and Prolotherapy on my shoulder by myself to get that better. Where now I can sleep on it, I can throw stuff, I can put my jacket on. I don't have to worry about that. In terms of my foot, my ankle, I don't have to wear Frankenstein shoes anymore. I can kind of use the footwear that I wanted to use. And so as time went along, I slowly implemented this into my practice, and to a point where, I've treated several family members too as well. My own mom was quite skeptical of many different things in general. And, it felt like it was just a great alternative to people, for people who didn't want to do drugs or surgery. For myself, for what I did, I couldn't take pain meds all the time. I know that the non-steroidal anti-inflammatories that we take are actually detrimental overall to our health. The more that we take them, they can impair your immunity, they can impair your ability to actually heal, they can actually destroy your kidneys over time, which I've actually seen on a couple of patients a long time ago, kind of
mm,
abuse them. And they increase your risk of bleeding too as well. And so you can bleed internally from them. And then some of them also have black box warnings for heart attacks too as well. So it's not
goodness.
something you want to just chronically utilize just as a way to get by. And so this is when we integrated that. We also integrated more holistic based treatments in our practice as well. Because there are many patients who simply don't want to be on medication. So we integrate some level of functional medicine along with that in terms of trying to make everybody good, not only from the outside, but then also from the inside.
Yeah. Well, I really appreciate that because I know when I go to the doctor, I want the most natural solution that you have. Like if you could just tell me I need to eat berries, whatever it is, or do this stretch, but that really isn't how doctors tend to be trained uh,
Hmm.
in general. So I'm always so grateful to find a doctor. So you have all the intellectual knowledge and that intense amount of training, and then you've done more training to be more holistic, and I very much appreciate that. So the can you tell me more about the therapy that you used? The did you say prolotherapy or
Prolotherapy. Yeah.
PRP? I know there's a clinic I've worked with out here
Mhm.
that they use that. Can you explain what that is a little bit more?
Yeah, sure. So, prolotherapy has been something that's been around for a really long time. Just even then, I kind of was part of I kind of even did a medical mission with a certain organization that goes out to Central America to treat patients too as well. And so, what this really entails, it entails a solution that actually causes like a localized area of damage and creates an inflammatory reaction that tells your cells to come to the area to try to help heal it. So a common thing that's utilized is something called dextrose, which is essentially sugar.
Okay.
There are other substances that can be used too as well, but that's by far the most common one. And then what PRP is it's called platelet-rich plasma, and so that essentially is the blood that we extract from our cells. We draw it out, we spin it down, we concentrate the growth factors, the platelets that are actually inside the blood, and they have a lot of growth factors that can help heal once they degranulate or open up, essentially. And so, that kind of is a bit different than the prolotherapy because it's coming with more growth factors to help heal the area, whereas the prolotherapy is telling the local cells to come to the area of damage and whatnot. This kind of does a little bit of both. And then when you go one step further up, I mean, we also do autologous stem cell therapies too as well, which is basically coming from your own bone marrow and also fat too as well. But that's kind of like having like the foreman and the construction crew and everybody just orchestrating everything in terms of trying to get things healed and ultimately over time. And then there's the idea of trying to help regenerate the tissue or the cartilage. And so we have to be careful about saying those kinds of things essential as well because more studies need to be done. But the proof is in the pudding in the sense when we do the imaging, we look back at the tissue or the area of damage and we see that it's improved after doing the injection.
Mhm.
Shows you that it lends itself to actually doing that.
Yeah, that's great. So I know patient education is a big part of what you're doing. And you have at least one book out. I know I've
Mhm.
seen.
Yeah.
What kind of things are you doing for patient education?
Yeah. So, I mean, things that we do in our office. So the book that you mentioned, it's called it's called Getting to Pain Free.
Okay.
How to live your life without drugs or surgery. And I wrote this actually during the pandemic. Because we all had that kind of free time back then. And
Yeah.
so I kind of wrote that, and it kind of chronicled just a little bit longer version of what I talked to you about, as well as some patient cases. And it also goes into things with diet, exercise, gratitude, mindset, those kinds of things. And so, it's being utilized as a tool to show you that, hey, there are other alternatives to get better ultimately. And so
Mm.
that's something that we provide to patients too as well, in showing that, hey, you don't have to do steroid injections, you don't necessarily have to do surgery, you don't have to take pain medications, which can be quite addictive, and there's a lot of patients that are simply on these things. Um, that are not getting much better and they're on them. So I think that certainly gives a certain level of education to the patients. We also try to make sure that we have newsletters going out to as well to educate patients about different treatments, but also the common things that we treat as well that are also neurological and different things from a holistic point of view, things that we could do to try to help things. Whenever I see patients, in my office, we always talk about, well, what are the lifestyle things that we can do? And so
Okay.
initially when they come in, for instance, they're saying, "Okay, my head hurts." Okay, your head hurts, but then we start digging back. Okay, what are what are your stress levels like? How's your sleep? What's your exercise level at? And what are the ergonomics of the the area that you're working in? How are your hormones? Have you been exposed to any toxins? Have you been sick with anything recently? And just keep digging and digging and digging to things because tell them, look, the head is the victim in all of this, but we got to look at all the little different pieces that kind of contribute to making your head hurt, essentially.
Right.
And so we try to go over that essentially and give them more education about that. And I'll even show them, okay, maybe we just on a bare basic level, even if we didn't go that much further, if we eliminated a few of these things or in your diet or did this exercise or consume a little bit more water or just tweaked your sleep a little bit like this and or change the ergonomics of what you're doing just at the most basic level that surprisingly a lot of people don't know or don't implement, can make like a huge difference. I'm just giving you this
Yeah.
as, just as one particular example. But that's some of the ways that we try to implement more patient education.
I love that so much, and, that is always, like I was saying, always what I'm looking for when I go to the doctor, and
Hmm.
it's hard to find. I can tell you that as soon as you hit menopause as a woman, you go into a
Hmm.
doctor's office and you're just slapping prescriptions out of their hand. They're handing them to
Yeah,
you as fast as you can, and you're slapping them away. I am slapping them away as fast as I
yeah.
can. And even, I've had one a doctor say, "Well, you don't need this, but you qualify," like it's a really cool thing. And I'm sure some women love that, but I'm just not one of them.
Yeah.
So I'm always looking for things like what is, the and some of the things you mentioned are just, they're habit things that
Hmm.
really, we have to make an effort to change habits, like, have to
Hmm.
make an effort, and I'm just saying the things you mentioned, and you tell me if this is correct, but drinking enough water or is, like if you're forward like this all the time,
Hmm.
the slouching
Yeah.
thing that's like we all are, that's going to affect your neck. And,
Hmm.
um, are you moving your body, you know,
Yeah.
in exercise? Like, so, are you just eating junk and not drinking water and not moving and then coming in and saying, I couldn't do anything, so I have to take a
Mhm.
prescription?
Yeah.
um, that's going to cause you other problems, probably.
Yeah.
Is that kind of a good summary of what you were saying?
Yeah, I mean, that's like at the most basic level without diving, even further and deeper. Yeah, I mean, it's common things that, I'll go over that. Look, at the end of the day, I mean, it's kind of rare that you even hear other patients say that their other doctors even talked about any of this stuff.
Yeah,
And it's probably because they may not be doing much of it anyway either. So they may not know either.
yeah. It's some of this stuff is and it is, changing someone's habits. I have and or changing my own habits, you know?
Hmm.
I'm sure it's not an easy thing if you've been doing things a certain way for so long, but
Yeah.
the good news is, sometimes I think really minor shifts in mobility training or, whatever it might be with your shoulders can have a big effect on that.
Yeah.
And you see patients for all kinds of neurological
Hmm.
problems. I know was looking at your. Can I read them off? What I saw.
Yeah,
There's
sure.
a lot. Sleep disorders, headaches, seizures, memory issues, sleep apnea, chronic pain, tremors, dizziness, peripheral neuropathy, concussions, Parkinson's,
Hmm.
essential tremors, which I don't know what that is, stroke, Bell's
Hmm.
palsy, um, and then some more. I can't read my writing.
Yeah,
Um,
yeah, it's quite a variety of things, and obviously on their gym side, we see like a lot of people with shoulder, back, neck issues, elbow issues, foot and ankle, and as well too as well. And so when patients come in, they can come with a hodgepodge of different things. There are also patients that will come in and they may have like 10 different things that they want to get looked at, and it's trying to like peel all the layers sometimes can be challenging for all those folks, but we try to work through it and trying to get them better.
so do you find it's connected, like, if they come in and have a neurological or brain health issue that is connected to other body issues with pain?
Yeah, so I mean, here's the thing, with when it, so for instance, just try to maybe give you like a good example. So if somebody has just in a brain fog, for instance, there's going to be like a million different reasons from it, from perimenopause, menopause to medications, gut hormones, things like that. But a lot of times, just, I'll pick, look at one thing with them. We'll talk about their diet, we'll talk about their gut and how is that going. And I can tell you how many times people who have headaches have bad gut issues that are like going on. And they're like, well, how did you know? Like, why are you asking the question? How did you know that I had like a stomach issue? I'm like, oh, it's again, these things are interconnected here as well. We often talk about, at least from the holistic functional medicine world, if there's some gut issues, it can lead to downstream effects throughout your body. And in this case, we're talking about more neurological. And so, in order to address the headaches, we may need to address the gut issues a little bit too as well, and that might be able to help make things better ultimately. And so that makes, that can make like a huge difference. So digging into seeing what their food sensitivities may be, what their chronic stressors are, because quite honestly, a lot of stress causes somatic dysfunction, or meaning it affects your body. It's just from the inside out, you can't see it. And so that in and of itself causes physiologic changes. And so you kind of have to work through some of those things as well. But again, there are a lot of downstream effects from other systemic issues that go on. And they will come in for a theoretical neurological issue when the idea really is it's more of a systemic issue or a gut issue, hormone issue, musculoskeletal issue, or something else.
Yeah. Well, and I actually had that experience this last year where I went to talk to a brain doctor here in
Hmm.
Reno, who the Brain Health Institute,
Hmm.
and it was more business. But he said, "Well, do this, the protocol. Um, I've actually had it on the podcast what they do, but."
Hmm.
And he's like, "Well, you have some gut issues." So it's
Hmm.
exactly what you said. He said, "But don't tell anyone a brain doctor told you that you have gut issues." And I'm like, "I've
Hmm.
never had gut issues." But then I started noticing after he said it, I'm like, "Oh, they've developed." Uh,
Hmm.
Totally related to, you know, anxiety from probably work situation. So, yeah, that's an interesting thing that, you can see that. He saw it on a brain scan. Um,
Okay, yeah, that's interesting. Yeah, I mean, you can, the gut issues can also affect things like serotonin and other neurotransmitters and things like that. So
yeah,
that's interesting. With the scan that they were able to see this, I kind of wonder what scan they did.
yeah, yeah. It's interesting. I might have him on too. Maybe
Mhm.
I'll ask him to come on and then we'll do a series
Yeah, no,
on
that'd be
brain
great.
health. Brain health has to do with everything.
Yeah.
So, I'm really curious because some of these things, like I have family members, for instance, someone who's just had a really fast, memory issue come on. So,
Hmm.
and then another one with, more full-blown Alzheimer's. So,
Hmm.
what are some of the things that you do for, like, memory issues?
Yeah. So for memory issues, it's kind of what I was mentioning, where we really need to um, go back and peel the layers with all of this. And so, I kind of even then I have like a memory course called Reclaim Your Mind that I just literally just launched. And so
Nice.
it kind of talks about, and this is what I talk to a lot of patients, especially is there are so many things that can contribute to your memory problem. Um, and I mean, I literally have kids coming in who are like in their 20s. I can't remember things,
Mhm.
and to people who are much older, the people who are in between. And so we kind of have to educate folks on that there's so many different things that can actually affect your memory. Doesn't always mean that necessarily everybody's going to have Alzheimer's or whatnot, but people may be surprised at like the things that actually affect their memory. And I'll just give you some quick examples. Say for instance, so um, say sleep for people. Sleep. I When we grew up and things like that, there wasn't the internet, at least until obviously much later. And then, cell phones didn't really exist when we were growing up in college. Still had the little
Right.
recorded like tape recorder for like voicemails and things like that. And so what I'm getting at is that we weren't like in a 24/7 society essentially.
Yeah,
So it's kind of like constant emails, communication, social media, and all of that. And so, theoretically, people were sleeping relatively better at that time. And there were other stressors or whatnot. But I commonly see a lot of people who are not sleeping very well ultimately. And so, when they're not really sleeping really well, what kind of can happen then is that you're not going to really have the best memory in the world ultimately. And so it's not just, the fact that, maybe your mind is racing at night, but it may be disrupted sleep, like sleep apnea or abnormal leg movements or abnormal behaviors at night or whatnot. For some people, with the insomnia, it could also be because they're on their phones and their computers up until it's time for bed. They're literally like scheduling their time for bed, just like they do the rest of their day. And so it's anxiety provoking for people too as well. And so I could just give you a quick example of, the Northeast. We had like Superstorm Sandy back in 2012, and I still had some sleep patients that were having difficulty trying to get to sleep.
Yeah.
And at that time, the power was out for like a week in this area because it was that bad, at least the infrastructure with the electricity. And so now these people who said there was absolutely no way that they could go to sleep at like nighttime are now going to bed at like 8 o'clock, 8:30, very easily. That tells you the power of, what you have with something like this, or
Mhm.
your iPad, your tablet, your computers and all of that, because that can really affect you. And so when you
Yeah.
give your time, give your mind some time to quiet down a little bit, you're not exposed to this all day long. That can really help it make it easier for somebody to fall asleep. And therefore, as their sleep gets better, initiating and consolidating it, they can actually remember things a lot better too as well.
Yeah.
I'm just giving you simply just one example of something that could be affecting your sleep. There's so many more things, from blood
Right.
pressure to blood sugar, which is often gets brushed aside even for people who are pre-diabetic, because that progressive insulin resistance is going to cause breakdown throughout the whole body, including things upstairs ultimately. And so sometimes it's called like type 3 diet, type 3 diabetes as Alzheimer's. Essentially, it's kind of, as this insulin resistant progressively worsens, that's going to affect your mind. And so that really, lends itself to, how we eat, how we exercise, how we take care of ourselves. So that's also really paramount. And I think a lot of times, given all the processed foods that are out there and the stuff that we consume, people aren't really paying attention to that. If everybody could have like a glucose monitor on their arm, if that was ever possible at any point in time, you can really see what happens. For instance, like when you eat something and see what happens to your blood sugar. And so, I have one because I like to keep track of things. But you can tell if you don't eat the right kind of thing, what happens is, if you look at like the graph, you'll see it spike like this, and then insulin will shoot in and then drive your blood sugar down to the point where you're almost hypoglycemic and you start getting shaky and dizzy and all of that. And then you got to eat again to get that blood sugar up. And so it's this constant yo-yo that's going up and down. And so, but
Yeah.
if you eat the right kinds of things, you may see a little bit of a upward swing, and then it comes gradually back down. And you'll notice that, those things don't really occur or whatnot. And mentally, you're going to feel a bit better too as well once your blood sugars are not spiking. So those are just, two quick examples. But even in the course and with patients, we go over lots of different factors and things that could be affecting their memory. So if we could tackle a lot of those things, that actually can improve people's ability to prevent Alzheimer's. There's, I think it's quoted around like 30 to 40% of cases actually could be prevented if you were more proactive in doing various different things, from addressing your sleep, your blood pressure, your blood sugar, toxin exposure, and many other things too as well.
That's a significant, so 30 to 40% could be prevented just by taking some time to change our habits, is
Right.
what I'm hearing. You
Yeah.
know, watching one thing I've started doing is turning off my Wi-Fi at night, but that's
Hmm.
I've been in apartment, and this is interesting too to me because, like, I think most people don't go from I've lived in apartments for the last 3 years-ish, and I've always lived in homes before that, but I think
Hmm.
the Wi-Fi really has interfered with sleep and stuff like that too. Like, I do think there's some issues with that, so now I've turned it off
Yeah.
at and, that helps, but, like but turning off, like, trying to make it as dark as you can is hard,
Hmm.
is helpful to me,
Hmm.
and, not having my phone, not having any electronics in my bedroom,
Yeah.
and just, but, after a while, you're like, I want to feel good, I don't wanna feel crappy,
Hmm.
I wanna feel decent, and it's hard to get there, like, if, life goes along and you stop exercising
Hmm.
regularly, and that totally affects, your gut, your brain, your how you feel about
Hmm.
yourself,
Yeah.
and, the life habits aren't I mean, they're not easy because life is life, and it can get
Right.
tense. But I love that you're focusing on just saying like, "Hey, how are you sleeping? Are you turning off, are you getting rid of electronics when you need to sleep?" And that and food. So is there foods that you've noticed are good for brain health and stuff that isn't good related to blood pressure or however it is? Like how do you manage that?
Yeah, so it depends on the level of what the patient is willing to do. So it's kind of like a little bit of a negotiation to a certain extent, and also a little bit of commitment on the end of the individual. But there are, two ways of doing this. I mean, there are certain generic ways of helping people out in general versus taking a deeper dive and seeing food sensitivities. Theoretically, people could react to strawberries and kale and not even know it.
Mhm.
Um, um, but like in general, I would say things that would be probably just on a very general level of things that actually cause issues in people. And anything that's pretty well known is gluten, for instance, can definitely be there. So
Yeah,
things that are bread related, people I've seen have more brain fog on it, have a lot more digestive issues
yeah,
ultimately versus being off of it. And sometimes eliminating gluten is all well and good. Like you put the bread away and all that, but there can also be cross contamination with a lot of things too as well from gluten, and so you can have to be diligent about that. And that doesn't necessarily mean go to the gluten-free section in the grocery store because they're laden with fillers and sugars, things like that. So it's kind of trying to educate people on that about these things because that certainly can lead to like a lot of brain fog in people too as well. Um,
yeah,
I would say a lot of processed foods for sure, things that have been refined multiple times. Just like I mentioned, leaving the gluten-free stuff. That stuff can be pretty noxious and pretty bad for you too. And sometimes it's also just stuff that's really going to spike your blood sugar. So even then, this is kind of parsing hairs here like a little bit because some people can do well with it, some people not. So even if you ate some other grains and things like that, even if it was some like quinoa or farro or whatnot, it may be fine for some, but for other people, it just might spike in their blood sugar up. And so it's kind of that yo-yo that I was kind of like mentioning too as well. And so anything that's kind of really spiking that blood sugar, if it's possible to monitor it, people may notice that they're more brain fog and tired and fatigued, and it's hard to think. I can tell, if I've eaten something that I shouldn't be eating, I feel like my head is like somewhere else and it's hard to think and concentrate. My brain is slow. And there are times, you may even feel like a little dizzy from doing that. A lot of people may not even have that same like reaction to eating something or whatnot until they eliminate a lot of it out of their diet too as well.
yeah,
But I eat a lot of stuff also with extra laden sugar and things like that. Um, and this is not just sodas and things like that, which I think a lot of people have cut down on over the years. But it's even like you go to the fancy coffee shops, which we all may know, where there's a lots of sugar laden things that are putting in there, and it's coffee, but it's a high calorie dessert that's there, and some people
yeah,
will consume that on a daily basis, unfortunately. So just things can be disguised as healthy when they're not.
yeah. Well, you're definitely speaking my language. I went gluten. I'll call it gluten light 15 years ago because I did a gluten fast with my daughter, and
Mhm.
after that, I couldn't. It was hard to go back. I
Yeah.
didn't realize until that point that it was affecting me, and
Hmm.
sometimes sourdough and or pasta from made in Italy I can do better with, but I've noticed even that is I feel that super heavy. Need to go take a nap. Don't quite
Hmm.
feel right. So which is such a bummer.
Yeah,
Think I'll
I
probably
know.
do some
Yeah, I
sour.
know.
Yeah,
Yeah, yeah. No, absolutely. Because yeah, there are some people that can do that and tolerate it better, and some
yeah,
people not so much, and that's kind of where it comes down to the individual. Like I can tell you, just to that example, I had a patient who was originated from Ethiopia, and I was telling her, saying, "Look, we gotta cut this out." But she's like, "Why? When I go back to my country, I eat all sorts of bread, and I do everything. I start losing weight, my body stops hurting." And so they can tell you to, the quality of the food is ultimately, how much better it is abroad and
yeah,
less things that are put in there.
yeah. I think that the United States is. is a trash bin. The food can be just a trash bin,
Hmm.
unfortunately. And I'm not sure what to do about that, except for I keep talking about it.
Yeah.
Maybe if we all get mad, something will happen. But so you said you're starting some patient education about this, or what did you say you're starting related to this?
Yeah, so there is, so there is a brain course that I have called Reclaim Your Mind,
Okay.
and just literally just put it out, and can always give you more details about that. But it's something where it goes into a lot of the details of what could cause memory issues and to tackle things. And so, just like I do in my practice, I try to have some things that are proactive as much as possible. So at the end of the day, we do have patients that are already at the end of the spectrum, and then they can be really, really hard to treat, or they may be so far gone, there's not much left in terms of what you could add and do, even though there's small tweaks you could do. But inevitably, that downward spiral is kind of to that point where there's no return really
Yeah.
from that. And so, let's use that example. Like, we don't want to end up over there like many patients do who don't take care of themselves. I want to try to be on the proactive side. And so it kind of goes over, again, various different things from, um, I mentioned like sleep, diet, exercise, other factors too as well, toxin exposures. And it also talks about more about, different things that can be looked at or things can be checked by your doctor or ways to be screened too as well. And so that people can take a little bit more of a proactive approach in terms of trying to improve their memory ultimately, or tackle those things so that they don't get into that boat. It's not something where it's going to give you all these brain exercises and all that, because there's a million things. Those things are online and they're everywhere and whatnot. But it's kind of more, how do we try to prevent from going from point A to point B in terms of what I've seen like in the gamut of patients over the years or whatnot. And I think that's something that certainly can be valuable in today's day and age when a lot of people, there may be people like between their 40s and 60s who are struggling with taking care of their kids, working and doing everything, and then they feel like their mind is going a little bit and they don't have control over that, and so
Yeah.
that can be quite difficult. So it's kind of really targeted to a lot of those folks in that age range where they feel like things are starting to slip and they're wondering what can we do, what kinds of things can we tackle.
I love that. So is Reclaim Your Mind, is that on one of your websites? Or how can you just put that
Yeah,
out?
there's a link on our website, ProloHealing,
Okay.
.com, and then we can also provide the link to you with the show notes too as well.
Yeah, that'd be great. That'd be great. I'm very interested in that. Well, and I probably can say this on the show, but like, we just had a family incident where my eldest aunt went very quickly from just having a few like things that weren't quite right with memory to
Mhm.
being in a place that wasn't memory care but assisted living, to
Mhm.
walking out and into the cold 30 degrees, and we didn't find her for a long time and she could have died, and that happened within the course of a few weeks.
Mhm.
So like that's it's very very concerning when you have
Mhm.
something like that go on, and it was so fast. It's like certainly maybe there's a fast upswing to
Mhm.
it too, but I
Mhm.
think as life goes on, it just these things can become very much very personal, to your
Absolutely.
family and to yourself, and they have names and people attached to them, or it's yourself. So
Yeah, absolutely.
yeah, yeah, and I've dealt with brain fog. I think my whole
Mhm.
adult life, and going back, it was I didn't realize it for a long time. It was Lyme's disease. Didn't
Mhm.
know it for like 15 years or something like that. And
Yeah.
so almost there's an emotional component to that too, because you just feel
Mhm.
like you want to hide it.
Mhm.
You don't want people to know that you're not uh, fully functioning. I think,
Yeah.
especially when you don't have an answer for it. So um, that's another reason I like to talk through these things, and like and find people who know a bunch of stuff and see what you can do. Out of curiosity, do you ever recommend detox protocols for people? Is that part of what you do, or not really?
To a certain extent, with things, because I think also depending on what the condition is, You also have to be a bit careful, especially if you're going to chelate things and things like that too as well.
Yeah.
But for instance, not necessarily like a detox program, but you mentioned Lyme too as well. I mean, we do have things that we have patients on to help them, especially post Lyme, to help with cognitive function, pain, and all that too as well, which we've had some success with too as well over the years too. But it's also in terms of dietary things too as well. It's kind of more of like an elimination kind of thing, and then refining things based on food sensitivities and gut protocols and things like that. But not necessarily like any like IVs or anything like that that would help with I think detoxification or whatnot. But there are herbal ways to like do detoxification too, and so there's
Yeah.
certain protocols you can use with like the liver and whatnot and the gut too as well to try to help with detoxification.
Yeah. Yeah, and I did that for a while. It's been quite a while, but I went through a couple
Mhm.
of years of different things like that. Herbal detox, and I think now it's really like I really just feel like I need to be sweating. So,
Mhm.
like, not like I was at the beginning of the podcast where that was a hot flash, and I hardly ever have hot flashes anymore, but,
Yeah.
like, working out and sweating or getting in a sauna and sweating, and man, I do
Mhm.
feel a lot better after sweating, which is another habit kinda thing.
Yeah.
Um, so body's detox pathway. Okay, so you have a couple different websites,
Mhm.
Advocare, Neural Wellness, and then
Mhm.
ProloHealing.
Mhm.
So, do those things hit different? Why is there two? I should ask
There's
that.
two. Yeah, there's a reason why there's two, and so it's kind of trying to parse things out a little bit. Um, and so with the Advocare Neuro Wellness MD, it's kind of more geared towards more specific neurological issues and things like that.
Okay,
Whereas the Ascend Regenerative or ProloHealing.com website kind of goes more towards more on the regenerative side with everything, more on the holistic side with everything. And so
okay,
we just try to give people presenting information in two different ways. And so that kind of lets people focus in on the things, or at least the issues that they want to come in for. They can focus on those without being confused, essentially. So we try to give it more clarity in terms of where to go versus putting it all together with every single thing, and then it's confusing.
yeah. It's a lot of information to digest for sure, and
Mhm.
and I don't think I could even begin to pick your brain on everything in one podcast 'cause, you know a lot, but so you're doing some other one thing I saw on your website was a, M7 laser sound.
Yeah. So, with the regenerative side, it's, just colloquially, I mean, it's prolotherapy, PRP, autologous stem cells, essentially.
Okay,
But there are different modalities that we also will utilize to help heal and make things better. Outside of the internal holistic stuff that we mentioned. But two of those treatments, one of which you mentioned, is the ML7 laser, and so that's called a class 4 laser. And so, just in layman's terms, what that means is most class 4 lasers would be the ones that actually burn things. And so this
okay,
one doesn't. It actually works at like two different wavelengths, one to help with more acute inflammation, one to help with more chronic inflammation and damage. And so the idea behind this is to try to get over some of the acute inflammation or the acute pain one is in, but also to help with the chronic inflammation of the pain. And so when we use it with regenerative treatments, when we're trying to initiate PRP stem cells or prolotherapy into the area of damage, there's something called photobiomodulation, which is what this laser does. And so it actually works on a cellular level where it can help with the repair and the healing at a faster rate, ultimately. That's what we're looking to do with that. And so it also will help smooth out some of the ups and downs you may have after regenerative treatment, because many people may not know that it actually takes time to heal. It's not something that's like instantaneous, or it happens like in a week or so for some people.
right.
So it takes time. So it helps smooth some of that stuff out in between, and helps diminish that pain in between, and helps with the healing too as well. And so we find that pretty helpful for those procedures that we do, even as a standalone. If for somebody who has been in a lot of chronic pain and is not a surgical candidate for anything, or they may not even be a regenerative candidate, then that's something that can dampen down their pain a lot too as well, where they can become more functional. So even though it's not a 100% kind of thing, it's something where if we're able to give somebody, between 50 to 80% improvement, ultimately, that could be like a huge lifestyle change for somebody where they actually can do the things that they actually want to do.
Yeah.
And so then on top of that, we also have like shockwave treatment. And so shockwave treatment basically are like pressurized waves that help stimulate internal healing too as well to the areas of damage. And so it's been used in sports medicine for a while, even in podiatry too. And so we'll often combine that also with our regenerative treatments because we're trying to hit things from multiple different angles. And so what I found, and this is even by mistake many years ago when we were doing things, is inevitably if we're able to get multiple pieces going at the same time, the outcome is going to be better too as well. No different than when somebody comes in and we talk about headaches, and I'm telling them, just say for example, we're going to work on this gut related thing, this exercise, this ergonomic thing, consume more water, and a few other things too as well. It's multiple things as well. It's not the idea of, well, when drug reps then they try to come into the office and say, are you prescribing my medication? Like, no, that one pill is not going to be the solution to all this. And I don't really do that all the time. It depends on what really helps the individual ultimately. And so at least on the regenerative side, just adding all those things together, I feel like gives a better outcome ultimately in terms of improving that person's pain
Yeah.
versus sometimes just being a simple standalone, even though standalone simply can work as well. It sometimes just may take a little longer.
So like a standalone can work. Um, what do you mean by that?
So meaning, we it's not like we don't do regenerative procedures as by itself without laser or shockwave and thing. We've been doing that for like a long time. And so, people can obviously still get well with that and do well with that, depending on where they're at functionally with everything. There are those folks who may respond to that, but to get like a higher level of improvement and relief or elimination, they may need those additional modalities of treatment to help them get there.
Yeah. So I imagine you have people come to you from different parts. Do people come from different parts of the country when they hear about stuff? Or is it
Yeah, I
kind
mean,
of
yeah, I mean more within the local states that are nearby. We have people come by too as well.
yeah. It is hard to find someone who knows the so much but will do the natural, give the natural options and stuff like that. So it's I know there's some things like that in Reno, not necessarily what you're doing, but little pieces of it. I
Yeah.
know I've had people on who do PRP or have different laser treatments or whatever. So
Mhm.
it's a thing you can find probably, if you look in your community, maybe you got to travel a little bit, or
Yeah.
maybe you just go have a nice week somewhere else.
Yeah, I know it is. Like even then, I mean, I've had, for treatments I can't do on myself. I mean, I'll go travel somewhere to get it done. And so that's not uncommon. Not everybody may have those kinds of means to do that or whatnot. But, I
Yeah,
feel like, compared to what it was when I started doing this, because there weren't a lot of resources when I started even, I mean, yeah, back 2011, 2012, it's not like it's ancient history, but there was just
yeah,
a lot of resources that just weren't even there at that point. So it was kind of hard to
yeah,
find anything at that point.
right,
Now
yeah,
there's so much. If we just look around a little bit and then try to do our due diligence and vet things, and we can certainly find things that could be helpful.
yeah, for sure. And you have these great resources for people. So you have your book, and then you
Mhm.
have the course that's coming out,
Mhm.
and of course there are these things that you were talking about that are actually free,
Mhm.
which is just changing your habits can be free. Um,
Doesn't
you know
cost you a dime.
what's that?
It doesn't cost you a dime. If anything, it would probably
Right.
save you money by making those habit changes because it will cost you less in terms of missed work, chronic issues that you may have that require medications or surgical options.
Yeah, for sure. Okay, so another question based on family members. What about dizziness?
Yeah. So that's one of those things where there's a million things that can cause dizziness.
Okay.
So it's so multifaceted, and so when people talk about dizziness, one of the most common things people talk about is BPV or benign positional vertigo, where essentially what happens is that there are crystals in the ear canals that kind of just dislodge a little bit. They make people acutely dizzy and things spin around. They feel nauseous, and then it's kind of self-limited, but people can have recurrences. And ENT doctors talk about vestibular migraines, which is a nebulous diagnosis. There can be ear infections. There can be so many different things that can lead to that. And so whenever I look at a patient, I'll ask all sorts of questions related to that. But I'll also ask them, okay, what kind of medications are you taking? Because medications in and of themselves can make people feel sick without realizing it, and
Mm,
not feel so well. And we see that often in patients too as well.
yeah.
Another thing that's also overlooked, I feel, is chronic musculoskeletal issues, particularly affecting the neck, because there's a lot of what we call proprioceptive input to the head, in the eyes. And if you look at things anatomically, if you looked at a model or whatnot, how close all of these things are essentially. And so it's like this really elaborate connection system that our brain and our balance centers are ultimately with everything. And so if you kind of throw anything out of whack, then that certainly can make people feel more dizzy and more lightheaded. And so, just say like on the regenerative side, when we've seen people who have had, headaches that have been raging for a period of time and they get dizzy, changes in their vision. For instance, we may do diagnostic blocks back there and find out that their symptoms are eliminated for a couple of days or a week or two. And hey, these migraines and this dizziness you've had has been coming from your neck the whole time. It's just you've been covering up with pain pills essentially to try to make things better or whatnot. And so addressing that underlying issue, and say for this example would be something like PRP, say for instance, to help stabilize the ligaments, tendon, and joints would help eliminate something like that. So that's just one scenario. Another scenario is, again, what are we consuming? Whether it's gluten or dairy or sugar or something else, those things certainly can make people feel not the best in the world. And so being able to look at that deeper is really important.
Yeah.
For the younger folks that are out there in particular, I mean, supplements are all well and good once we know why we're using it, the quality of the supplement. And I do realize they're not FDA regulated, but I feel like there's a difference between supplements from company to company still.
Yeah.
I've trialed things over a long period of time, and some things will work better than others. Doesn't mean it works for everybody or whatnot, but a lot of people may take supplements and things like that that actually make them feel sick when they don't feel well and they don't realize it too as well. It's causing an issue that they don't understand.
Yeah.
And so it's kind of looking at all these things to peel those layer backs, which are important. And then for some people, they may need to have, a vestibular therapy along with the gait therapy integrated so that it actually helps them too as well. And we're talking about things from nutrition to musculoskeletal issues to therapy or whatnot. Again, it kind of goes back to that, multifaceted approach in terms of just trying to help someone get through everything.
Yeah, and we're all we're an interconnected being.
Yeah.
So, you know, it is really interesting to me too. I think the shoulders and neck can affect so much.
Mhm.
We hold weight of the world on our shoulders, and the stress goes there, and we tighten up, and or
Yeah.
we're looking like this, and the neck is not right from the devices. So yeah, that's an interesting area to look at for sure, and probably a lot that can be done.
Yeah, it's there's always so many different things with that. So it's always interesting, depending on what the individual comes in with.
Yeah, for sure. Well, Dr. Meehan, thank you so much for sharing your wisdom with us. Can you tell people how to get a hold of you, how to book an appointment with you?
Yeah, so I mean, like the websites that you mentioned. So I mean, there's ProloHealing.com, for more on the regenerative side, and then there's also Advocare Neurowellness MD for more on the neurological side. So those are
Okay,
websites there, and you can book an appointment, give us a call through there.
nice. And you're in New Jersey?
New Jersey, yes. Mhm.
Yes. Okay. So if you're in the New Jersey area, or if you just want to just head out there. And then for people who aren't in your area, you have the resources that we mentioned. Can you get the
Mhm.
book? Where do you get the book? Where's the best place to get that?
The book is on Amazon, so pretty easy to get with that. So that's helpful. Also provide also the links for the memory course and even like the quiz that kind of sees like, do you really have a memory issue or not? And we can
Yeah,
certainly provide those links. You can give them in like in the show notes and all that.
I'm very interested in that.
Mhm.
So awesome. Well, thank you again so much for your time. I appreciate it, and enjoy the rest of your day.
All right, you too. Thanks so much for having me on the show.
Did you like that? You can watch more episodes here, subscribe over here. We actually have new episodes with awesome guests every Thursday, so check back in. Is that all?